Uh, Good evening and pranam to one and all. My dear friends, I welcome you all in 296th episode of the podcast. Seriously, when we started, it's a visionary, it is the brainchild of our own dynamic Foxy President, Dr. Sunita Tandulwadkar, madam. And we started, we thought, I don't know what will going to happen. And really, we are so grateful that we are near to complete 300 episode of podcast, irrespective of anything, every day, 8 p.m. We all are here with some wonderful guest, and always ma'am is there to bless us. So thank you so much, all of you, this wonderful series of the Gyan Pravah, that is a podcast series. And today, ma'am is in a flight, so unable to join. And on her behalf, our very dynamic Secretary General, Joint Secretary, Dr. Ashwini Kale ma'am has joined. Again, ma'am doesn't need any introduction. Ma'am is very dynamic, always working, a dear senior to me. And definitely, I always used to say, in you, ma'am, I am seeing the picture of Sunita ma'am. So thank you so much, ma'am, for always blessing us, for always, for always there for all of us. So before we start, I just want blessings from our Joint Secretary, Dr. Ashwini Kale, ma'am. Ma'am, over to you.
Thank you so much, Apurva, for the kind introduction. A very warm welcome to Mohammed sir from Bangladesh. Sir, this podcast series is started by our president, Dr. Sunita Tandulwadkar, madam, and I must tell you that she has given a platter of opportunities and visibility to all the 31 committee chairpersons, where every day at 8 p.m. they interview one person who is very famous in their own field for the benefit of all the gynecologists and the general public. She makes it a point to join each and every podcast. When we started this, I was wondering how will ma'am be able to find out so much of time? But that day she said that once I have committed, it means it will be there. So except for when she is in a flight or on the stage inaugurating our conference, she is there for all the podcast every day. And I think this is one quality that I've really learned from her: dedication, despite of whatever comes in your way. 8 p.m. sharp, she's always there. We're very proud of Apurva and his work. And I think Prayas is one of the programs that he started in Fogsi, which is sexual education to the boys also. And we are reading so much of news these days about sexual harassment. So I think now the time has come to at least make people aware about what sexual harassment is, what sexual education and what sexual violence is. So this is going to be a very great initiative through Foxy. And another program, sir, that Foxy is running throughout the year, which is Sunita madam's brainchild, and her project for the year of Foxy is Sampurna, which is on preconception care. So in that preconception care, we are not only targeting the mothers or would-be moms or girls of adolescent age, but also their partners and husbands and men, so that they also become an important part of this preconception counseling, where it is very important for them also to understand the health of the woman, that whether she is ready to take on this responsibility of motherhood and parenthood. We are also explaining them and counseling them about contraception, which is also an important part, and nutrition and nourishment, which is equally important. So this is our project, sir, which has started this year and which will be running for the future years. A very warm welcome to you, and I think I'll join in from the viewers link and enjoy your podcast. Thank you once again, Apurva. Thank you, Mohammed sir, for joining us all the way from Bangladesh.
Thank you. Thank you so much, ma'am. Thank you so much. Thank you so much. My dear friends, after the blessings from our Joint Secretary, very dear friend, senior and mentor, Dr. Ashwini Kale, now it's time to introduce Mohammed Samsul sir. Samsul sir, again, those who are in a sexual medicine and those who know this is not a new name. Sir is a very dynamic. Sir is currently the president of South Asian Association of the Sexual Medicine, and sir is among the first certified, sexual therapist, sexual medicine practitioner from Bangladesh. Sir is very dear senior to me, and in such a short notice, sir is joining. So thank you so much, sir, for always being there. Thank you so much, sir, for always being joining. So without we are wasting the time, now it's the time to we start about what all about the sexual health and why the sexual health is so important. My dear friends, we all know 25th November every year is celebrated as a violence against women, and the sexual violence against not only women's but men's are also now at a growing age. And somewhere the sexual health unawareness is one of the main cause of that. So today we will discuss what about all about the sexual health, why it is so important, and what we can do to actually prevent this type of the sexual violence against the people in general. So thank you so much. And sir, before I just want to start this, I just want to know you why this knowledge of the sexual health and the sexual problem is so important. When I last time I am taking a lecture in one of the society, the Fogsi society, and they are saying ki, we have a lot of problems, like maternal mortality, the perinatal mortality, IUGR, anemia, etc., etc. And you are always talking about the sexual health. Is it is really so important? So just I want to ask from you, sir, why this knowledge of sexual health is so important? Yeah, over to you, sir.
First of all, thank you so much for having me. So I just want to, remember Professor Neeraj Yadav, who has introduced me to Foxy, and Professor Apurva sir. And I also want to thank Ashwini madam for her nice words. So before starting everything, there's an old saying, knowledge is power, isn't it? So when we have started practicing sexual medicine, it was a completely new chapter to many of the people because it was the bread and butter of the herbal practitioners and Ayurvedas and all the traditional healers. So when the physicians come into play, they talk about, can you hear me?
Yes, sir, absolutely.
Okay, thank you so much. So we talk about the science and art behind sexuality. So once you are aware of the anatomy and physiology, once you know about the impact of early life trauma in your future sexual life, so that makes people they can correlate what is happening now and what has happened in the past. So knowledge is very important, and based on the scientific evidence, if you can explain them properly, many of the problems can be solved easily. And we have seen that many patients get improvement with 1 or 2 sessions of psychoeducation, which consists of giving them a proper knowledge about the physiology, how it happens, and the relationship. So knowledge is power. And at the same time, once you can make them correlate with the past events, they can easily seek help. They don't feel shy, and they don't think that it's a problem of their own, and they can understand that it's a disease. So when you consider, there are 2 models. One is the moral model, when everything has been considered as a crime, your incapacity to get involved with your partner makes you feel ashamed of yourself. But when you know that there is a disease process which can happen, and not only in you, in other persons as well, so they feel much relieved. So in that case, many of your informations, proper scientifically based information, can reduce your stigma. It can enhance your knowledge and can engage you in therapy sessions. So it is very important.
Absolutely, absolutely, sir. Because there is always, you correctly said, there is always a stigma of this. And what happened when when I was thinking that when I was just growing from adolescent to, childhood to adolescent, I have a lot of things in my mind. And there was nobody who actually gave the correct information. And nowadays, people are actually searching from the Googles, and they are getting all the wrong and misleading and the wrong information, and this make their life so miserable. So you have very correctly point out, sir, ki when we are getting the psychosexual session, the giving the correct knowledge, and definitely it will improve their sexual health and etc. Yeah, thank you so much, sir. Thank you so much. So, sir, just I want to know, because you are a practicing sexologist, sir, how common it is? Is it is really so common? like in case of male as well as female, because sir, females are always considered as the passive partner. So is it is really common in them also? Just I want to ask from you, sir.
It's a complex question because if you see about the prevalence, sexual problem is very common, and it is related to each other. Like for many of the sexual dysfunction we have seen in the women, one or the other from at least there's a evidence that 50% of the women's sexual problems are related with male sexuality. For example, if someone has got female sexual dysfunction, at least out of 100 patients, 50 of their partners will have either erectile dysfunction or premature ejaculation or a low sexual desire. So one's problem affects or impact on other problems as well. So it's a dyadic issue. On the top of that, there is also another dimension of seeing it because, like I said earlier, that childhood trauma can impact in your future life. For example, if some lady, some child has been abused sexually, either penetration or without penetration, they may develop vaginismus, now we call it genitopelvic pain and penetration disorder. So she may not have any clue why she is so, she withdrawn, but she has got full love about her partner or husband. But when it comes to sexuality and physical aspect of the sexuality, that is intercourse, they feel withdrawn. They get suddenly very tired, frightened. So your early life experience can impact your future life. Your partner's sexual problem can impact your sexual life as well. So it's a very difficult situation. But at the same time, lack of knowledge, also people live in a dilemma whether it's a problem or not. When to report, when not to report. So it's a very common problem, and most commonly is hypoactive sexual desire disorder. That means people, women get less interest having sex.
Absolutely, sir. And sir, many times what I feel, because as a gynecologist, I'm also practicing the sexual medicine. What I feel that somewhere the domestic violence or the violence against women, one of the cause might be the sexual dysfunction, because the couples are very much disheartened, and if they are frustrated, and their frustration is actually converted into the violence against women. Sir, what is your intake in that, sir? Is it is true, sir?
Absolutely true. See, there are difference, but generally it is said that women's sexuality lot depends on emotional aspect, and men's sexuality lot depends on the physical aspect. So I'm not, shaming anyone, just how it is, but it's not always right. I'm telling this is not always right, but it is said that women are more emotionally driven when they they engage in intercourse. So, if someone's partner is violent, abusive, and try to shame his partner, that means the wife, so she may not get turned on. She may not feel the desire, even though she may have responsive desire. Like, for example, she may have lubrication, but mentally she may not feel coming close to her partner. So domestic violence is very important. A good chemistry, very good harmonious relationship is important for women. At least her partner has to be nice, and always you need to have a element of surprise, because in a long-term relationship people get used to it, they get bored. So always you need to, recharge and rejuvenate the relationship. Otherwise, it becomes monotonous. So yes, for partner violence plays a crucial role. And we, I'm a psychiatrist and also a sexual medicine practitioner. So as a psychiatrist, as a sex therapist, we say if there is a marital disharmony, don't go for sex therapy, because you need to adjust the marital disharmony. Otherwise, your sexual, intimacy will be, hampered severely. So marital problem, if there is any partner violence, has to be addressed. And there are many studies, there are meta-analysis and systematic review which have shown that partnered violence causes significant sexual dysfunction among the women. Also in men, but more in women. Thank you.
Absolutely, absolutely. It's a very correctly said, sir. And sometimes I feel, sir, it is either way around. Suppose that there
Right.
is a male sexual problem also, and what they are thinking that they are unable to satisfy their partner or they are not attracted to the partner, then they can also turn to be violent. So
Right.
it is the other way round also, sir. And you are
Mm.
very correctly point out, ki yes, it has a direct correlation with the sexual problem and the sexual violence. Sir, I want to know that because till now in our medical education, I think
So, sorry,
the
Apurva sir.
Bangladesh. Yes,
Just sorry to interrupt. I just give an example that will. I will give two examples that will
yes,
give
sir.
you an idea how it affects each other. I saw a patient where the male partner, husband, brings his wife saying he has got low desire. So I took interviews separately, and the wife told me that her husband has got ED. So when I dig down, I try to now my patient has changed, shifted. So then I found that husband has got a good sexual function at the beginning, but he has got problems with ED, but he has got the full intention of doing sex. Then I did the did some investigation, and ultimately I found out he has got a hyperprolactinemia. He has a brain tumor, which ultimately causes hyperprolactinemia, and that causes ED. So ED due to the husband affected the partner wife, and wife was disengaged because she's not getting the satisfaction. So it is a rare thing, but it happens. In many cases, I have seen this type of situation. In other aspect, the husband has got paranoid psychosis. He was a substance user. He used to engage his wife because he developed the idea that the wife may be infidel. She may have secret partners. So she used to beat her, and wife was busy, doing the household chores and other things, keeping the children and making their daily living. That also created wife disengaged because sometimes she is busy with other things. And that made the partner more suspicious. Why she is denying me? She may have some secret partners. So eventually goes on and on. And now I have also seen a female partner who has got paranoid psychosis. I'm a psychiatrist, so I do
Yes,
see
sir.
patients as well.
Yes, sir.
So
Absolutely, sir.
paranoid psychosis patients, she may not have the desire, but she repeatedly keeps her husband busy having sex. She may not have the intention of getting pleasure, but she wants to make sure that husband didn't go anywhere else. She is more busy with herself. So that makes the husband more frightened. So one's problem affects other in the relationship, and it goes on in either direction. Sorry to interrupt.
No, absolutely, sir. Sir, this live questions are actually very beneficial for us because many times we are actually treating the female, but actually the problem is with the partner. So
Right.
it was always, yeah, very correctly said. And I have attended one of lecture you're online, and you all always said this word, sir. Ki for in the sexual medicine practice, we have to treat the couple and not the individual.
Right.
Even if the problem is coming with either the husband or the wife, we have to actually treat both of them because many a time the problem in the female is due secondary to the male, or problem in the male is the secondary to the female. So it's very true, sir. So thank you so much, sir, for bringing out this, sir. Sir, just I want to ask you because sir, in India definitely, and I'm sure in Bangladesh also, our medical education doesn't contain any you can see the basic knowledge of how to identify the sexual problems and how to treat it. Till now, no, we are actually working on it. So those who are actually, sir, want to know the knowledge. So how they can go out? Because sir, you are a president of one of the great organization. Sir, what's your intake in that? That who wants to just start how to get knowledge this about say the sexual that how to treat and how to identify this.
It's a very valid question, and I just want to take the opportunity to talk about a few other issues. See, SASEM has been engaged with the different societies to increase the knowledge, skill, and attitude towards the patients. We basically work on the doctors. So in Bangladesh, we had been in constant engagement with the Society of Gynecology, OB-GYN Society of Bangladesh. We have that is called OGSB. We are engaged with the Urology Society and Psychiatric Society, Dermatology Society, Endocrine Society. So with 5 societies' help and with the help of our Indian colleagues, we have set the school that is called the SASEM School Bangladesh. For the last couple of years, since the inception in 2017, we have already trained 300 doctors. So what we treat, what we basically educate, we hire, we invite faculties from internationally, from Europe, Asia, India, Bangladesh, and the best faculties, and we invite the specialists who are already in the field. So we created some module. With the module, we give the common aspects, and basically we try to follow the European Society of Sexual Medicine has a school. It's a unique school all over the globe. They have trained for 2 weeks, but we, concised it to 3 days. So what we teach, basically, we talk about the anatomy, physiology, the cardiac aspect. That if you treat the husband, and he may have a cardiac problem, and then many people are in dilemma whether they should treat them, or whether it causes cardiac added problem, or what to do. So that is one thing. When to approach to other physician, and how to play in a liaison model, like when to refer to a gynecologist, when the gynecologist will refer to a urologist or psychiatrist, and so on. So we created a module with which we try to engage the different societies so that the patient gets their best care. So in the process, I know that Professor T.S.S. Rao sir has made a short protocol of 6 months fellowship in India, and also they have got a master's course. So I think Fogsi can take an initiative, and I like to go beyond that. This year we are trying to give at least 10 scholarships from the South Asia to join Bangladeshi school, the SASEM School Bangladesh. So it will have 4 international speakers who are very much renowned, and they will be there. Indian faculties will be there, Bangladeshi faculties will be there, and we just want to, like I said, the 300 plus doctors we have trained in Bangladesh. So we want to extend the horizon. So I will request you through you to the society if they can come up with 2 scholarships. So we will give them online links, and they can join us, because at this short period of time, it will be difficult to get the visa. So thank you.
Thank you so much, sir, and thank you so much for this great initiative. Because many times, what I feel at the starting, probably the patient, when I was not in the sexual medicine, sir, what happens, sir? When the patients are coming, because I am seeing the cases of infertility. So the patients are coming and they are saying, yes, I have this problem. So even I was really scared because I don't know how to identify what's the problem and how to treat it. So I think this is a great opportunity, sir, Hannah, for all of those who wants to join and who wants to learn. And I think being a gynec or being who just because nowadays sexual medicine is a full-fledged, subspecialty, and people are practicing that. So this is a great opportunity. So thank you so much, sir, for bringing out that. And really, it will be a great help for all of us. And sir, I just also want that as a president of the South Asian Society of the Sexual Medicine, sir, I just want to know what actually this organization is doing, like for the creating awareness or giving teaching to the professions regarding the identify or treatment. Sir, I just want to from you.
Thank you. So SASAM is based in Bangalore, and it has got members from the South Asian society. So basically, they have got two fronts. One is the patient education. We have uploaded the different psycho education models in the website, and also we have got a training initiative like one in the SASAM school, and there are frequent webinars in India. I'm not pretty sure whether it's happening now, but the next person is going to be Professor T.S. Rao. He's a very busy person, and who is very much into teaching and initiative. So SASAM basically works with doctors and to give and implement the highest standard of care between different disciplines. And anyone, OB-GYN can be a member, because they have a crucial role in dealing female sexuality, and also the infertility and associated other factors. So basically, it's not a one person's game business. It's a discipline which incorporates basically 5 disciplines, and OB-GYN is a very important stakeholder. Besides, they have got urology, dermatology, endocrine, and psychiatry. So what happens? We are trying to bridge between the different societies, and like you said, that it's a growing up promising subspecialty. I'm not pretty sure whether it came up as a subspecialty, but in Europe, in South Asia, we all practice sexual medicine on the top of our primary specialty. Like, I'm a psychiatrist, you're a gynecologist, or also you're saying you're practicing infertility. So SASAM wants to make the highest standard of care. Bringing up the new issues, which are the most advanced research finding, and to disseminate and share the knowledges between the different participants. For example, let me clear one thing, that regarding infertility, you will have a lot of male and female sexual problems. Recently, we went through a research between the infertile male and female. We have seen many patients have got depression, anxiety, and stress, along with sexual dysfunction. For example, women had got more, depression, anxiety, and stress, but men has got more sexual problem. Well, the men has lost their sexual frequency. The women has engaged in more sexuality. The baby making has overshadowed, and it took over the sex making. So these are the situations where you need to have an interdisciplinary model of care. So thank you.
Absolutely, sir. You very correctly said. One of our in my city, one of gynaec sent me a patient. Actually, whatever, there is a 5 year of marriage, and it's an unconsumable marriage. And both husband and wife are so comfortable with that. And they went to the IVF, and they said, ki, yes, I just want to have baby, so do my IVF. So, and they say, no problem. Okay, the husband report, wife report is absolutely okay, but it is a case of unconsumable marriage. Then that the doctor sent me that couple. So absolutely, you are saying, sir. Now actually, people are more into like to having sex to have a to make the babies. Many people are into that, especially those husband wife, like in big cities, they are working both husband and wife till morning to night, and they are thinking, oh, it's nothing. So it's very important. So I always ask to tell my patient, it's not it should be the recreational. It's not should be the prosecution. It's not the to have a sexual intercourse is not only to make the babies. It's have to that feeling between you and husband. I think this is one thing now which give a bond, or else it is like a room partner. Like when I am staying with my colleague, or in during my hostels, and we are sharing everything. But we don't have a sexual intercourse. So if the husband wife is not have a sexual intercourse, there's like a room partner, and there's a nothing like in the marriage. So definitely, sir, you very correctly point out that yes, this is very important to have a sexual intercourse, not only to have babies, but also to have a inner feelings and to have a great bonding between the couples. Absolutely, sir. And thank you so much. And sir, just I want to ask, suppose that a person from India, like a person like me, want to join the organization of the South Asian Society of Obstetrics, the sexual medicine, how to proceed it?
See, the society is based in Bangalore. So anyone can give the yearly membership fees and can join. And especially gynecologists are most welcome because we want more and more gynecologists to be on board. So this society has got a lot of urologists and psychiatrists, also dermatologists and endocrinologists. And some gynecologists are there who are practicing sexual medicine. So it's a yearly membership fees. The membership fees, you can go and check the website, and you can go to the secretary as well. And we usually give the membership drive around the this time, November, December. So anyone can be there, and it's a a yearly membership fee. And this membership fee will give you the access to all the ISSM university online. You will have a membership ID password created, with which you can go through every detail that has been there in the cloud. In the ISSM website, there is an ISSM online. You have got every module there. So over the years, that has been there. So if someone is going to study, they can go there. And you can be a good candidate for the, applying for the SASAM scholarship as well. And with the membership, you can, access to the different conference with the, subsidized registration fee. There are a lot of membership benefits. So it's a Bangalore based. And I can give you the link after the conference, so with which anyone can join.
Yes, absolutely, sir. I can share in the different groups, and definitely it's working great, sir. And that will definitely boost our knowledge and boost our practice, sir. It's absolutely, and I think because what sir, as a obstetrician gynecologist, I feel that we are really close to our patients, and if there is any problem with the patient, they discuss with us. And probably this is one thing which is not touched, and they are very open up with their gynecologist, so they are able to tell that their problem. So I think it is a very good, sir. Thank you so much, sir. Thank you so much, sir. So sir, one very vague question: how to start a sexual medicine practice?
See, no one has been born as a sexual medicine specialist. Over the years, you will get some your experience shapes you. Like not all OB/GYN doctors are practicing sexual medicine. You had been there for a while, and ultimately you have gone through it, and now you are taking lectures. So every time you are shaping your knowledge. So one thing is that I'm not sure about the OB/GYN, but in Bangladesh, the university where I work, we have a module on sexuality, and which is very detailed. And I think as a Fogsi is the prime federation, they can develop a module. They can negotiate with the government so that they can implement some sort of syllabus in the the gynae practice. So what happens once you introduce it to the module, then the people will learn from the beginning. I can give you one example. Though we work with all the societies, for last 10 years, we had been introduced. Since I work in a university, I have got the opportunity to introduce the things that has been there in the psychiatry, but we made it very precise and accurate based on my experience in Oxford. I had been there. I was trained there. So that short module has given me a task how to proceed. Then once I introduced into the university course, so over the last 10 years, there are a lot of young stars has been produced in psychiatric arena. Some based on that, the dermatology society also introduced some module, very much based on their practical aspect. So there are some dermatology factors, there are urology that had been there. So I will request that some module you can negotiate to introduce into the syllabus, and the webinars you are doing it right now, all the faculties will go through it and they can understand. Yes, it's been there. So they will shape their knowledge, and regular arranging seminars, symposium, attending international conference, and if possible, if anyone can join the ESSM school, which is a very unique school. I was trained there. My journey has started from there, and over the years we have learned a lot. But that was the journey. We have been to the 3 days course. Anyone is welcome to join us. So that's it. So it's not a one solution to all problems. It's about the module you introduce. You train them with different, workshop, seminars, this podium, and podcast, so many different things, and ultimately they will learn.
Absolutely, sir. So this is a very I think, sir, this is one practice now. We don't need any very hefty instruments, and we don't need any costly thing. And I think to start a practice, I think this is one specialty where you don't need much things, and it is to start a practice is actually nothing. And basically, you need just a knowledge, and I think, sir, yes, sir, the
Skill.
fellowships from your
Knowledge, skill, and
and the
attitude.
teaching. Yeah, absolutely, sir. Skill and attitude, that is very important, and definitely it is one subspecialty which is, I think, the investment is the minimum. What I feel when I compare with the other things. So absolutely, sir, it's very true. And anybody who can have a knowledge, who have a anthu to practice, and who have a anthu to give the correct treatment to our patients about this very unteached, untalked, and untouched topic. I think this is a very good thing. So, Samsul sir, actually, we discuss a lot of things. Before we wind up this, I just want to ask you if you want to share your some cases, though you have shared like 2 cases, very wonderful cases. If you want to share some cases, what you are thinking that, yes, these are unique and definitely it has a good impact. Sir, anything from you? Yeah.
See, there are a lot of cases, and let me share one example. So how even the doctors land in trouble. So one of my patients who was an engineer, he came to me, and to make a long story short, he had married for about 1.5 years. Initially, his problem he had unconsummated marriage, but he went to a doctor who has given him testosterone, and it didn't work. And then he went to a psychiatrist. He gave him an antidepressant, SSRI. Basically, he had one intercourse when the semen came out even before penetration. So that we call antipodal premature ejaculation, but it comes out before penetration. So he went to a psychiatrist, and psychiatrist has given him medication with which he could have done successful sexual intercourse. And since he was a medical doctor, her husband was an engineer, she has consulted with other doctors of her friends. Her friends said, don't do this, don't take medication, you will be dependent on this medication. So she stopped, and her problem started again. Because she didn't take the medication, her husband took medication, but she didn't allow her husband to take medication. So eventually, she had got a premature ejaculation, and it persisted once she stopped the medication. And then the people around will say that once a problem will never be solved, because the doctor was consulting her senior friends who were she was an intern, I guess, but the rest of the doctors were either 5 to 6 years senior, but they are basically junior doctors. So if that lady, the doctor, was an ignorant, normal fellow, normal person, she won't listen to her doctor friends. Then the problems could have been solved, because she already got at least satisfying sexual intercourse. But once she was consulting her other friends, there was a stigma. And they say, don't take medication, you have to have organic sex. So ultimately, they stopped medication. And the husband had all the parameters were normal, but the investigation he did was in the late evening. And you know that the testosterone has a diurnal variation. If you do it in the late evening or the evening after 3 or 4 p.m., definitely it will come lower than the reference range, which is actually incorrect.
Normal.
Basically, he has a normal function, but since he
Hmm.
did it in the at the late
Evening
evening or
time.
afternoon,
Huh.
that came low.
Absolutely.
So there was a
Absolutely.
series of mistakes, and I was asking him, the guy, because he came to me after 1.5 years. If there is any way you can bring your wife because she just gave him divorce, he said, no, we just finished 3 months because after you give divorce, there is a period where it is still valid. We can work on it. So see, it gives us an example. There are mistakes in different tiers, different levels. One was the mistake in the hormonal profile, because if someone comes out prematurely, definitely his testosterone will not be low, because low testosterone comes with delayed ejaculation. So that was a mistake from the lab and the timing. Second was the stigma, because the lady initially got treatment and she was cured and she has got her orgasm, but she consulted with the other doctors and the doctors gave him a wrong signal.
Wrong signal.
Because premature ejaculation, if it is a lifelong, which starts at the beginning of your intercourse, from the first day, it is a condition where you need to take medication, which is absolutely fine if you take once in a while, not regularly. But even if you take regularly, that doesn't definitely cause problem. But they may create problem, but not always. So the second problem is he had fixed this problem, but due to the stigma, he has to discontinue and he lands up in trouble again. So there was a potential situation where the marriage can be salvaged. But due to the lack of information, lack of psychoeducation, the doctors tell him, the doctors put the person in a disarray, in a difficult situation, difficult spot. So that's why we need to treat our doctor community first about the sexual health. Because a lot of times you get stigma from the doctor community. So a scientifically based information is very much required for the doctors, and this is how you can treat the whole nation. Because once you can train a doctor, a proper sexual medicine which has been practiced in the Europe, because we try to see the model template of the European training system. So that can make a huge impact after 10 to 20 years. And I appreciate Fogsi because they have taken up the initiative, and that I am pretty sure it's a society of 30,000 or more, right? I heard 39,000, right?
Sir, yes, sir. Now it is 44,000, sir.
Excellent. So
Excellent.
with the initiative run by you, Professor Neeraj, and I don't know about the whole, esteemed your faculties, it will make a tremendous impact. Trust me, tremendous impact. You have to make a module, train them properly, and your doctors are an expert, knowledgeable one, because Fogsi has a very bright members. All the members are very bright. So if you can give them an appropriate model, definitely you can have a massive change in 10 to 20 years, which is impossible for someone or Sassan to make that change. So I just want to extend our all the support. The Sassan will be always with Fogsi. Whatever kind of cooperation we can do, we can learn from each other. Sasam is there, and you have made the right initiative. With this initiative, we can make a change in the whole South Asia. I am very much happy to be here with Fogsi as well. Thank you so much.
Thank you. Thank you so much, sir. And sir, we are really blessed that we have very great leaders. And our past president, our present president, Dr. Sunita Madam, and this podcast is the brainchild of our Sunita, our very dynamic Sunita Tandulwadkar Madam, and the next president is Dr. Bhaskar Pal sir. These all are so dynamic. Every Foxy president is so dynamic, and I think yes, sir, definitely it have a great impact. And sir, when we are getting and associated with the organization like this, like yours, sir, so definitely it will has a great impact, and we will definitely do in future also, sir. Thank you so much, sir. And and you have wonderfully explained that, sir, about that case. Even this is the thing which just I want to tell my audience that what we are thinking, that the husband is engineer The wife is a doctor, so they are well educated and they are aware of they have a much of the sexual awareness. So, but it's not true. You should not be judgmental. I have seen the person who are gym toned. They have a more sexual problems than the other people. So don't be, misleads by their thing. And definitely you take a very good history. What sir have beautifully tell this really wonderful case, sir. Thank you so much, sir. Over to you, sir. Yeah, your comment. You want to say? Yes, sir.
I am very much thankful to the Foxy leadership because they have taken the initiative. I am impressed by their, activities. Sasam will always be with you. Whenever you need Sasam, we are there, and we want to bring a change. And Sasam School, like I said, that I will extend through you, your leadership, to circulate the information to all the, Foxy members. It will be our privilege. And we'll be, hoping to provide 2 scholarship for the Foxy members. And I am very much looking forward to see the more and more Foxy members to be on SASAM membership. And through each other, we can share our experience and we can learn from each other. And thank you so much, and thanks for having me.
Thank you so much, sir. Thank you so much, sir. Thank you so much for joining in such a short notice. And it is a wonderful podcast. And definitely, it is a great knowledge sharing, sir. And our audience will definitely get the benefit. So at the last, I would like to thanks to our very, very dynamic president, Dr. Sunita Tandulwadkar, madam, for starting and for doing this 298th series of this Gyan Pravah, that podcast series. And thank you so much, the right left hand of our Sunita ma'am, our joint secretary, Dr. Ashwini Kale ma'am, for joining today's postcard on behalf of ma'am. And definitely our very dynamic ADR senior of my Dr. Mohammed Samsul sir, though I never met sir physically, but virtually probably more than 10 times we met, and it was really, we share a very good bond, sir. So thank you so much, and definitely one day we will meet physically also, sir. So thank you so much, and thank you so much technical team for taking all the pain to organize the podcast. Thank you so much.
Thank you. Salam alaikum.
Thank you.